You may be asking yourself, why are we talking about women's wellness in a setting where we're talking to entrepreneurs? Why are we talking about that? And the reason is because without health, there is no wealth. Furthermore, if you don't manage your physical wellness, you will not be able to take care of your fiscal wellness. And I also want to tell you that the first business that every woman has to be successful at is taking care of herself. This is essential for you. You must nurture the nurturer. And finally, if you don't take time to stay well, then you're going to have to make time to get well. That is the reality of life. And what I'm here to talk about today is a little bit about how menopause impacts on that. And what has menopause got to do with any of those things I was talking about? Everything. Absolutely. I thought it might be useful to tell you a little bit about why I'm so passionate about this particular area and how I got started in it. So I'll be very brief and just go through it. When I came to Boston in 1979, it was the year after the first in vitro fertilization, the first test tube baby in the world. And I was dead set on trying to do the first one in the United States. And what happened is I immediately jumped in and had the opportunity to do a lot of research with measuring follicles and timing ovulation and a whole lot of other things, and was actually one of the international leaders in menopause, in infertility. And my book on infertility at that time was actually used by Robin Cook to write one of his novels. So what happened was, after doing that for some 20 years, it became clear to me that this technology was evolving, and I found myself becoming more of a technician. It had gone from exciting and new and research to basically a redundant sort of a technical task. And so at the same time, my patients had been around for 15, 20 years, had wanted me to take care of them as they went from their reproductive years into the years beyond. And so I had many patients who were trying to get pregnant, but many patients who were beyond that point, and many of them were on estrogen. And then in 2002, there was a paper called the Women's Health Initiative, the WHI. And in that paper, it said that estrogen caused breast cancer, heart disease, and dementia, among other things. Now, it was wrong, but it was damaging. And estrogen at that time was the #1 prescribed medicine in the United States of America. It was like a $7 billion pill. Those are in those year dollars. And what happened was, all of a sudden, women started throwing their estrogen into the garbage can. They quit taking it. They had their symptoms back. They were angry because they had been taking something that was going to cause breast cancer or heart disease. And they were miserable. They were totally miserable. Well, 7 months after that paper, there was another paper that came out that said there was this new gene, this BRCA gene, this breast cancer gene. And it sounds like it's all about breast cancer, but now they call it the breast and ovarian hereditary syndrome. And really it should be also and pancreas, because there's a 22-time increase of pancreatic cancer with this BRCA. This is a bad gene. My wife, who had lost many of the family members to ovarian cancer, they died before 50, had always worried she was going to die of ovarian cancer, got tested, and was positive. So a month after that, she decided to have her tubes and ovaries removed. Now, if you have worry about ovarian cancer, just let me tell you, 70% of it starts in the fallopian tubes, not in the ovaries. So if you have your ovaries out, you leave your tubes in. If you know someone, they have to have both out to make a difference. So here we were in a situation where I had this growing number of patients who were in menopause or reaching it. And now I had a real why. I had my wife who was trying to figure this out, and she's going to be taking estrogen when they said it caused breast cancer, and she's got the breast cancer gene, right? So that's pretty scary. So I had to do a lot of research about this. And in fact, when you look at the data from the Women's Health Initiative study, the 2002 study, there are a couple of things you need to understand about it. First of all, the study wasn't about estrogen. It was about an estrogen named Premarin, a pill, and a synthetic progesterone called Provera. So Premarin, Provera, Prem-Pro. And the women who got the Prem-Pro were somewhere between 60 and 79 years old. And they couldn't get younger ones because everybody was on estrogen. They couldn't find anybody who wasn't on estrogen. So the women with the Prem-Pro were 60 to 79. The women with the placebo were mostly 50 to 59. The women who got the Prem-Pro had many smokers, hypertensives, and diabetics, all risk factors for heart conditions and other things. The women who were 50 to 59, who got the placebo, were basically healthy young women. So who do you think is going to end up worse? The older women, and they did. Now, we're talking about the older women, and so you may think menopause is all about age. But it's not about age. It's about transition. Because here's the facts. The mean age of menopause is 51 in the United States. But 10 to 20%, 5 to 10% of women go through menopause before age 45. 5 to 10%. 1 in 100 women goes into menopause before age 40. 1 in 1,000 women goes into menopause before age 30. 1 in 10,000 women goes into menopause before age 20. The face of menopause is every face. And the symptoms of menopause begin up to 10 years before menopause starts. So we're talking about a window of life, a swath of time, a group of women that's vast. 6,000 women a day enter menopause, 2 million a year. There's over 50 million women in the United States in menopause. And this has a lot to do with business. And let me tell you why. I want to tell you some of the studies that have gone on, because we know that compared to 2002, 80% fewer women, 80% fewer women today take estrogen than did in 2002. Fear, confusion, uncertainty, they don't want to touch it. So you're either going to play Russian roulette or you're going to do without it and you're going to grin and bear it. I don't want you to grin and bear it. I want you to grin. And here's some of the data that's happened as a result of not taking estrogen in this country. A study that came out in the American Journal of Public Health showed that doing actuarial types of analysis, a paper out of Yale, showed that the estimated loss of life of women for not taking estrogen was roughly 50,000 women died prematurely because they did not take estrogen, mostly because of heart disease. In addition, in another study that came out looking at the impact of women in the workplace, this is a study of 500,000 women complaining of hot flashes. Now you think hot flashes, what's the big deal? I can tough it out, right? I can deal with that. I'm a woman. I can deal with this. So 250,000 of these women were treated with hot flashes, for their hot flashes, and 250,000 women were not treated. The 250,000 women not treated for their hot flashes had 1.5 million more doctor's visits during the next 12 months. 1.5 million more doctor's visits, costing $400 million. And if you extrapolate that to the number of women with moderate to severe hot flashes in the entire country, We are talking about a cost to this country of $14 billion for our hot flashes. Not to mention the loss of self-esteem for feeling that way, the loss of productivity, the loss of focus and concentration, etc. Now, this has had a big impact on women because let me tell you more. In another study that looked at work ability, that's a term in industry for how much absenteeism do you have? How present are you when you're there? How productive are you when you're there? Women that were 45 to 55 have the lowest productivity, work ability of all age demographics. This is at a time when women are at their peak. This is at a time when women's wisdom is at its highest. And at this point in time, women are being deprived of reaching their peak potential because of it. If you look at the Bureau of Labor Statistics and you look at women in the workplace, we find that women are going through the sky in terms of participation in business, in every arena, every age group. Even older women beyond 65 are one of the fastest growing groups in business today. And although all groups went up, the group that was losing women in the decade between 2002 and 2012 was 45 to 55. 1 million women dropped out of the workforce. I know more went in, but 1 million dropped out. Why? Well, maybe it's the economy. Maybe that's part of it. But part of it is probably due to the stresses of menopause, having to deal with everything not being optimized. So this is a major, major thing. So to me, this story of estrogen is very important for women to understand. Now, I realize that everyone can't or won't take estrogen. That's okay. We don't have time here to go into everything, well, what would you do if you can't or won't? There are certainly things to do. I mean, you don't have to quit living because you can't take estrogen. Now, I'm not suggesting it, or there's nothing else, but I just can't talk about that. But let's do talk about the estrogen side of things. Because I feel that the most important thing that we can do is we have to educate in order to advocate. You have to be armed with the information. If you don't have the information, how are you going to talk to your healthcare provider in the 8 minutes you're going to get? How can you? Very hard. A paper came out in the New England Journal of Medicine last Thursday, March 2016. And in that paper, it talked about what's going on with estrogen in healthcare. Menopause treatment among the newer doctors and many of the olders is sadly lacking. They don't have the information about the latest stuff. And as a result, how can they convey to you what you need to know? It was part of the reason that I put so much effort into the educate part of this thing, because I feel very strongly about it. We created a menopause magazine because it's a simple way that women can get information. It's easy, it's readable, and it take a lot of the complex stuff and distill it down. We created a program, an online program that's got 5 parts that deals with body, mind, and spirit, so that women can be armed when they go to their doctor. You've got to be your own advocate. You've got to go in with information that you can use. And I wrote this book, this is just coming out, called The Estrogen Window. And I want to explain what this estrogen window is about. This is really a new concept and very important. When you really look at estrogen and try to understand how could they get it so wrong? How could the most popular medicine in the country become taboo? What happens is estrogen is not good or bad. What it is a medicine that, if taken at the right time, maximizes its impact and lowers the risk of breast cancer, heart disease, and dementia, among other things. And yet, if you miss the estrogen window, the benefits are a little less, and there is the potential for it to do the opposite and contribute Now, a lot depends on which estrogen, and whether you have a uterus or not, and you have estrogen alone or progesterone. There's more complex that I can say here, but that's what the estrogen window is about. It's not about hormonal balance. It's about how can you safely take something that can change your life at that time, at this time in life. So I know that we're short on time here, so I just want to tell you that you have a choice for your reality. Are you going to accept, grin, and bear it? Are you going to suffer through symptoms that can be treated? Or are you going to find out the information you need and optimize your life, lower your risk for breast cancer? As a matter of fact, breast cancer risk is lower 23% with estrogen only in women. There's so much to know to empower you. Get the truth, get the information. I want to say that if you're interested in menopause and you just want to know if you're in menopause or if you're post-menopause or where you are, I have a quiz. It's called menopausequiz.com, pretty straightforward. You can take the quiz and see where you are. It'll give you some feedback and help you. And
like the magazine.
What's that?
Your magazine?
The magazine is also available, and for the people here, talk to me and I'll get you a free prescription, a free subscription, a Freudian slip, a free prescription. And also we're going to have, I want to offer you, I'm going to give away 5 books today. If you put your business card in this basket, I'm going to pick 5 out and I will mail you a book as soon as it comes out April the 12th. And if you're interested, if you go to estrogenwindowbook.com, you can get a copy there with a bunch of bonuses. And anyway, check out the menopause quiz. And let me stop here to say, if you have any questions, it would be my pleasure to address them and try to answer them for you.
Over here.
Yes?
Quick question. You said that estrogen window, did you say 45 to 55?
No, the estrogen window... No, estrogen window has to do with when you go into menopause. And you may go into menopause at 35 or 55. Your estrogen window starts there. Now, it's more confusing about on the other end. And it's more individualized. And there's a different estrogen window for your bones and your breast and your bladder and your skin and your heart. Each one is a little different. But fundamentally, it's from the closer to the time of menopause you start, the 100% more certain it is that it's going to be safer for you. But there's ways around it. Yes?
I would love to know your thoughts about bioidentical hormones.
Very complicated topic, bioidentical hormones. Bioidentical means that the shape of the chemical is similar to what the body makes, okay? But bioidenticals are not natural, okay? The only plant they come from is the chemical plant. So there's nothing natural about them. They're configured in a now there's manufactured, you can get bioidentical hormones both from a regular prescription pharmacy. Most of the patches and other things are bioidentical, or you can get them at a compounding pharmacy. Right. Now, I have no issue with any of it, but understand this. The newest data out on the compounding pharmacies is a little bit worrisome. And the reason is because in studies that are done blindly, where 12 prescriptions from compounding pharmacies are sent to a chemical analysis place, generally the estrogen comes back up to 150 to 200% more than the doctor ordered. They fill it right, but it's not coming back at the right dose when they analyze it. And the progesterone comes back about 50% under what's ordered. So now there's been 4 cases of uterine cancer that have been reported from compounding pharmacies in the recent past. So if you take compounding pharmacy, then what you have to do is make sure that your provider is checking your uterine lining. That's the main thing. There's nothing wrong with it. But it's like when you take the M&Ms and you go into the ice cream store and they put a scoop in and they stir it up. It's all individually made. It's not uniform. So when you get a piece of ice cream, you may end up with a bunch of M&Ms and you may end up with none. And that's what, it's just, that's an inherent problem. Anyone else?
One more question if anybody has it.
Yes.
I see a functional medicine physician,
Mhm.
and she recommends supplements such as black cohosh and other things to help to alleviate the symptoms. Is there any conflict with using herbs and natural?
Can you use herbs with hormones? Yeah, you can. The herbs are good and they can help many of the symptoms. As I say, everything works for somebody and nothing works for everybody. But the fact of the matter is that the herbs will not do for you what the hormones will. Remember, in 1900, the average age for a woman was 49, but death, okay? That was the mean age in 1900. So we now are, the average age for women is going to 81 point something, and women, are, the fastest growing age group in America is over 100. So women are living longer. This is evolutionarily a new era. So you have to plan for that and protect your body for the long run. But nothing wrong with the mix.
One quick question. So I do the compounding hormones. So we've been doing it off of blood work. So you're saying that's not a reliable source, a uterine type?
If it was me and it was, yeah, I would 100% want to know what's going on at the end organ, which in this case is the uterus. Okay.
And how do I?
You have to either have an ultrasound, which will show the thickness of the uterus, and the thinner it is, the better. Usually it's under 4.5 millimeters. Or you need to do a biopsy, which involves a thin little plastic thing that goes in the uterus. A few cells are scraped out, and it's looked at under the microscope. It's like a one.
Is that a pap smear or no?
No. No. It's the pap smear is the outside of the cervix. The biopsy's inside the uterus, and the pain threshold is kind of, and then it's over.
The good news is,
I've seen about 10,000 of them is how I know that.
Is the ultrasound sufficient?
It's believed sufficient if it's down at 4 millimeters.
so the good news is, he's one of us. He's part of our community here in Connecticut. Dr. Mache, if you haven't figured it out so far, he's very approachable.
Yes.
You can reach, he's on our private member Facebook page. So if all of you at once want to reach him. So
That would be a hot flash.
Anyway, his wife is very forgiving, I know that. So Dr. Mache, I think we could do a whole workshop with you.
Yes.
So maybe we could do that
Yes.
sometime and bring him back.
I would be
We could
delighted.
do, you know, lunch or something on I will work it out.
This would be a summit kind of a thing where we could really educate the members because there's a lot to know.
And bring your daughters and your sisters and your mothers and your
That's right.
aunts and I'm thrilled that all of you are here, but there are so many more that need to hear his message. And he's so willing to share because he's a fabulous man. So thank you.
Thank you so much.
And he's going to be here for some questions afterwards.
I'll be delighted to talk with
So
anyone.
anyway, thank you, Dr. Mache.
My pleasure.
All right.
Thank you.
Anyway.
Huh?